Good afternoon. Today, I want to update you with the latest information we have about coronavirus here in Wales and the latest developments in our response to the pandemic. We have started to see some early signs of a reduction in the number of people testing positive for coronavirus. Unfortunately, we are still seeing a significant number of people admitted to hospital with coronavirus symptoms. That continues to put pressure on NHS services, including our critical care beds. There has been no reduction in the number of people dying from coronavirus. This week, we have again seen large numbers of deaths recorded by both Public Health Wales and the Office for National Statistics. Behind these numbers are people. My thoughts continue to be with all those families who have lost someone as a result of this awful virus. Our first slide today shows how cases of coronavirus have risen steadily in Wales, and we have a selected number of local authorities on the slide showing the picture since September. And you can clearly see the cases peak in Merthyr Tydfil and in Rhondda Cynon Taf, where we've seen the highest levels of coronavirus in Wales before they started to fall back sharply in the last few days. The 7-day rolling average incidence rate in Merthyr Tydfil has fallen from a high of almost 770 cases per 100,000 to around 420. And in Wrexham, which had the highest rates in North Wales, the incidence rate has almost halved to around 150 cases per 100,000. The overall Wales rate has now fallen back to around 170 cases per 100,000. In every part of Wales, the trend is down, except in Ceredigion, where cases are rising largely because of an outbreak in a care home. Sadly, and despite all of our efforts to keep coronavirus out, in many parts of Wales, we are now seeing outbreaks in care homes. It is still too early to see the full impact of the firebreak on coronavirus, but these are positive early signs. We need to keep building on this and make sure we don't slip back as we come out of the firebreak. Tonight, the Autumn Nations Cup starts as Wales play Ireland in Dublin, always an occasion of tension in my own household. This would normally be a big night out for rugby fans. I know that many of you will meet friends in the pub tonight, and many others will be looking forward to weekend plans or celebrating Beaujolais Day next week. We all want to put coronavirus behind us. But unfortunately, we can't behave as though coronavirus doesn't exist. If we try to go back to normal, we will lose all of the progress we've made over the last fortnight. All that hard work and sacrifice would be for nothing. This remains a highly infectious virus. It thrives on human contact. It spreads through the air, on surfaces, and when we're in close contact with other people. It particularly likes busy and poorly ventilated indoor spaces. The more time we spend with people, the more chance we will either catch coronavirus or pass it on. That's why we're asking people to reduce their contact with other people as much as possible. It's why we cannot just go back to normal now that the firebreak is over. If we want to keep the virus under control, we've got to stop bending the rules or stretching them to the maximum. And that means, for example, not booking 2 tables in a pub at a time and moving the chairs to get around the rule of 4. Instead, we have to look at our own actions. So if you're going out, book ahead and choose a venue, preferably which is well ventilated. Stay in one place, but don't stay out for too long a period of time. And stay with the same people and keep the group as small as possible. The rule of 4 isn't a target to aim for. And don't forget the basics, please. That's keep your distance, wash your hands, and wear a face mask where required. We won't know the full impact of the firebreak for a while yet, but the falls in the rate of infections, which I referred to at the start, give us hope that we will see a positive impact. We need to make sure that all our actions in the coming days, weeks, and months ahead continue to build on that. We have, though, used the firebreak period to review and strengthen our Test, Trace, Protect service to make sure it can support people through the winter. Contact tracing is a key part of our response to the pandemic. In Wales, the service is locally run, and since its launch in June, has successfully traced more than 9 out of 10 contacts identified by people who have tested positive. As more people get coronavirus, the service comes under greater pressure. We're creating a new central surge team to support local teams, and today I've announced new funding of £15.7 million to almost double our contact tracing workforce for the winter. We will recruit a further 1,300 contact tracers and advisors to help meet demand through the winter, helping us to identify new hotspots and isolating as many contacts as possible. The new self-isolation payment scheme will start on Monday. People who are on lower incomes will be able to apply for a £500 payment if they have to self-isolate because they have coronavirus or they're advised to self-isolate by the Test, Trace, Protect service. If we're going to break the cycle of infection, it's really important that everyone stays at home and self-isolates if they have the symptoms of coronavirus. And these are a high temperature, a new or persistent cough, a loss or a change in taste or smell. Most people who have coronavirus are infectious a couple of days before symptoms appear and for a couple of days after that. That is why it's so important that you stay at home with the first sign of the symptoms or if you're advised to by our Test, Trace, Protect service. And while you're at home, you can apply for a test. We have plenty of testing capacity in Wales. I want to thank everyone for the hard work during the firebreak. There are some positive but early signs that coronavirus rates are beginning to fall. If we're going to make a difference to the course of the virus in Wales, we all need to think about how we can make changes to our daily lives to keep our families safe and to keep Wales safe. Thank you. I'll take questions from journalists now, and we will, of course, broadcast all the answers to questions live on our social media channels. And the first question today is Mr. Robbie Savage, originally from Wrexham. Over to you, Robbie.
Good afternoon, Minister. First of all, I'd like to congratulate you and your team on yesterday's change to under-18 sport activity. I know how much that means to grassroots players all around Wales for their mental and physical well-being, as it did for me, having all my grassroots experience in Wrexham, for my father's team, Bradley, Brickfield Rangers and Sly United. So I'd like to congratulate you on that. But inevitably, parents will want to watch their sons and daughters playing, and they can't. Why is there a total ban on all spectators in football, from the Cymru Premier League at the top down to the grassroots game, even when 2 metre social distance can be managed safely in an outdoor environment?
Thank you for the question, Robin. Thank you for the recognition of the change and the guidance that means that under 18s in football at least can play. That's in line with the regulations, and we've revised the guidance to make that clear. In terms of parents not being able to watch matches, whether that's at, if you like, the top end of the adult game or indeed for junior sport, it is still about how we're looking to balance each of our responsibilities and how we keep each other safe. And it's about us as parents wanting to make sure that the activity for our children and young people can go ahead. I mean, I take my son to the rugby. He's in the juniors, but it's difficult when parents are on the sideline wanting to support their children and young people, wanting to be there to take part, and it really is something that I have enjoyed doing as a parent as well. But it's natural to gather around in groups and to talk to people, and people do get closer to each other. So we're trying to balance all of those risks, and this is the difficult choice that we face in enabling an activity that has great benefit for children and young people. We need to balance the risk for adults as well. And I know it's hard, but we continue to review the provisions. We continue to look ahead to understand the change in the evidence. And if we can make further changes, if we are changing the way we live our lives, then we'll look to do so. But we are asking parents not to stand on the sideline, to make sure they can stay in their cars, they can leave, they can return, But please do this to make sure that the change in activity we're now enabling for our children and young people can continue for the future.
Thank you, Minister. Can I have one more question, please?
Yes.
Thank you. What is the reason for limiting 30 persons over 18 for outdoor sport and activity in a controlled environment like the Football Association of Wales can offer during outdoor sport and activity which is safer than being indoors, yet indoor bingo halls and bowling alleys are not restricted?
Well, again, this is the balance that we're trying to strike. As I said at the start, this is a highly infectious disease. We know there are risks for everyone. And it's the balance in enabling activities to go ahead in some form, because you recognise the wider physical and mental health benefits from undertaking a range of activity. So that's why we've set a limit, and it's something about having a consistent set of rules for everyone. If we had different limits for different activities, we know that those rules are confusing and lead to people not understanding what they're supposed to do. So we're asking people to work with a single limit, to have a responsible person who will undertake a risk assessment for that activity, and then to enable people to undertake it. Now, I know that football and other activities would like to have slightly higher numbers to work with, but that's why we have a regular review. There are regular conversations with Sport Wales, the FAW and other governing bodies to understand how we can make progress in the future. But all of this comes back to how we keep each other safe. So we ask people to work with us, to understand why we're doing this, but also to look ahead to, if we can keep coronavirus under control, there are more things we'll be able to do in the future. Thank you for your questions, Robbie. I look forward to seeing you again in the future.
Thank you.
We've now got Teleri Glyn-Jones from BBC Wales.
Diolch yn fawr iawn, Minister. Thank you very much. So in England and Scotland, the £500 payment for those having to self-isolate has been available since October and was backdated to September. Can you explain the delay in Wales and explain why it hasn't been backdated as far back?
Yeah, look, we've had a practical challenge in getting all of our systems in place to make this work. We have got the additional top-up on sick pay. That's available for people in social care. The new payment that's available from Monday, we will backdate that to the start of November. And it's a simple practical question about being able to get all of our systems right, the mechanisms we need to go through local authorities, and the link up to our Test, Trace, Protect service. And that's actually a strength, because that means we're sharing information within the same organisation. And when people have that contact from contact tracers, they'll know that's coming from a trusted source, and they'll have advice to help them in actually understanding the payments they'll be entitled to and to signpost them to where to get it. So it's simply a practical question, and I'm looking forward to those payments being made available, because that should help to reinforce the fact that we want people to isolate and we're supporting them to do so. And that's hugely important for all of us as we look forward.
Thank you. And do you have any clarity on how it will affect benefits, and will it be taxed, for example?
Well, we've been trying to work with the UK government on the impact on benefits rules, and we're still looking to make sure that DWP are taking the most generous route possible to understanding how to interpret the different rules, because this is a very practical challenge for how people live their lives, often on a week-to-week income basis. So we don't want to see rules applied by the DWP that end up causing a significant problem later on. So those conversations continue. But as you'll recognise, there are payments available in other parts of the United Kingdom, and we'd actually want to see this disregarded. That's a position the Welsh Government takes. We look forward to the DWP continuing to listen to us and to work with us to help support people to do the right thing for them, their families, and of course the country. Thank you, Teleri. I've now got Adrian Masters from ITV Wales.
Thank you, Minister. I understand that discussions were held with the military yesterday about carrying out whole town testing in Merthyr Tydfil. Can you say how those discussions went and how close Merthyr is to seeing whole town testing?
Well, I think the starting point is that actually we're very grateful to the military for the support they provided throughout the pandemic. We've had very good relationships with them. They've been really positive, supportive, and they've been very much seen as honest brokers in the way our public services have worked together with them. So very, very grateful, and certainly not taking for granted the assistance they've already provided. And this has been helpful in terms of how we might be planning to do something, whether in Merthyr or in other parts of Wales too. And the closest, we still want to understand more about what's happening in Liverpool, to understand not just the numbers of people being tested, but whether we're getting to people we want to see tested and how that reflects the overall positivity rate. Because we want to make sure that people who are concerned about whether they really have the virus in our most at-risk communities are really coming forward. So I won't set an artificial timescale. The meeting was just yesterday, but either myself or the First Minister will continue to provide regular updates about where we might be on whole town or whole community testing, the part that might play, and of course the broader capacity within our testing programme.
Thank you. And I was struck by what you were saying about how we're not likely to be returning to any kind of, in inverted commas, normal way of life soon. And connected to that, the talks are ongoing about what could happen over Christmas to try to reach a UK-wide approach. Can you say what's in the mix? Because if we can't go back to anything approaching normal, what sort of regulations could be in place over Christmas? Could you tell us what's being considered?
Well, we're considering how, in the first place, how we behave now and the choices we make, and whether we can successfully limit the number of our contacts, reduce the time we spend with other people, because the biggest risk for any sort of change in the position around Christmas is whether or not we see coronavirus retaking off again. So it's a challenge in understanding where we'll be as we move ahead to that period in the year. And also we need to give people some time ahead to be able to plan. Lots of people want to move around, so travel arrangements across the UK are a big factor. We'd like, if possible, to have common travel arrangements and common expectations. We're also going to look to give people some guidance ahead if they want to spend time with people they haven't seen for some time, to think ahead of how they keep themselves and those people safe. We'll be looking at whether we can do more things about the numbers of people that meet indoors together, because often, whether you celebrate Christmas as a religious event or not, and many of us don't, it's still a time of the year where people want to gather together, and it's often more difficult to do so outdoors than in. So we're looking at a range of those things to try to come up with the most common route possible, to give people some advice and some guidance how to keep them and their loved ones safe, and we'll look to do that genuinely and positively on as consistent a basis as possible within the four nations of the UK. But you can expect to hear more from us over the coming weeks as we continue with those discussions. Thank you, Adrian. We've now got Will Hayward from Wales Online.
Thank you, Health Minister. The virus is now clearly circulating again in care homes, with 52 deaths linked to the virus in care homes just in the first 6 days of November. Wales Online has spoken to a care home, or several care homes, which tell us in no uncertain terms that the reason the virus has spread in their homes is because of issues around testing. In one care home, tests are taking a week to come back, and once there was an outbreak, they were only sent 6 tests in order to get on top of it. With COVID-19 clearly in care homes now, what you're doing at the moment to protect them is clearly not working. Exactly what measures is the Welsh Government going to bring in to get on top of this?
Well, there are a couple of different things there, Will. As we see community transmission, it's much more likely that coronavirus will get into all of our closed and protected environments. And that's why we've had another real focus again on supporting care homes on infection prevention and control. So that means we need to look again at all the process and procedure in place for a good reason to understand what happens. It's why it's really important that we've introduced the sick pay top-up payments for people working in the sector as well, so they can do the right thing and not be forced into a position to choose between going into work and be able to pay their bills or staying at home and not being able to do so. So there are a range of different things that we're doing, and actually we've provided new guidance on care home testing. We expect care home testing to take place on a more regular basis in most parts of Wales now, but that's a local choice to be made. And also with our regular conversations with the UK government around the Lighthouse Lab testing programme, we are now seeing a recovery and improvement in turnaround times. So I'm not aware of the individual example that you've quoted, but I am aware that as we see a general improvement, there may be some care homes that wait longer than we'd want to for those tests to be turned around, but it is definitely an improving picture. So testing isn't the only thing. It gives you an indication of where the virus is, but it's then about the way that each home works and the way that it actually understands, if it is circulating within their home, the measures they need to take to protect staff and residents. And that's where there's this very difficult balance in visiting and enabling visiting in an environment that is as safe as possible. So there's a number of things that we're doing, and I'll have more to say over the next week, as there is a review being undertaken to support care homes, and that's work being led by the Deputy Chief Medical Officer here in Wales, together with the Chief Nurse, and we're expecting to be able to have more to say in public about how we're supporting the care home sector to keep staff and residents safe.
Okay, thank you. It's not so much the how they manage the virus in their care homes, it's the fact that they don't actually know it's in their care homes for a week because of the slow testing. I'm going to stay on care homes, if I may. The public have no idea what the scale of the problem is. There is no publicly available data for how many residents or how many homes are affected. Last week you said that the Welsh Government and Public Health Wales would be putting this into the public domain on a weekly basis. That still hasn't happened. The data must surely be available and you must be using it to make decisions every day. Can you confirm when you will be publishing this data regularly for the public?
Well, whenever we publish data, we need to make sure that we're publishing data that is reliable. We have to go through a process with our statistical colleagues and indeed Public Health Wales to make sure we're telling people something that is accurate. So it is simply about wanting to make sure there's data people can rely upon. And as soon as that is available, we'll make it available. We're not looking to hide things from the public. I actually think it'd be useful for people to understand the nature of community circulation and what that means in care home environments where, to be fair, providers are already taking precautions and staff are behaving responsibly, but it's still the case that with higher levels of community transmission, we will see coronavirus in care homes in different parts of Wales, and it can have a really devastating impact. So that's why the support measures we provide are important. It's not just a question of the speed of testing, that I recognise we want to see that improve, as I've said, and we'll continue to look to focus on, and we will then be providing information when we have reliable information that the public can properly rely upon. Thank you, Will. And I've got Adam Hale from the Press Association.
Thank you, Minister. I asked this of the Education Minister on Wednesday, but it was dismissed, and there are concerns that new lateral flow tests, which will be offered to students before they return home from university, while catching most cases, do return a significant number of false negatives, meaning that they miss a number of positive tests, and that risk increases if a test is self-administered at home. Have you looked into these concerns? Because they do suggest that there is a real possibility students could be sent back around the country carrying the virus, having been told that they haven't got it.
No, so we are still in the process where some of this technology, the new tests, are more mature, and we understand how accurate they are, and there are other tests coming on board where we need to understand if they are accurate enough for us to use. So it's not something that is being dismissed by the Education Minister, myself, or anybody else. We need to understand not just the number of tests that are available, but how accurate they are, so they tell us something useful. And that is, of course, a regular part of what we do. You'll have heard announcements made in the past about the number of fast tests available. Well, the speed of testing is, of course, positive, but we then need to understand how accurate that test is, and that's why it's difficult to increase capacity to a time frame that is entirely nailed down, because you have to make sure that accuracy is part of it. So the validation process is hugely important to make sure that people have assurance when they're going home from university, or if we were able to have new tests deployed in other areas, whether it's care home visiting or any other aspect, that they're getting a reliable test to give them useful information and to allow them to manage risk and to make choices about how they keep themselves and their loved ones safe.
Thank you. And new evidence from the government's technical advisory cell suggests there are higher levels of infection and transmission in school-based age groups than previously thought, and schools being open is associated with higher rates of infection in the population. Given that, do you believe that new measures could be needed in schools to prevent the spread of the virus?
Well, I think it's really important to distinguish a couple of different things. The first is we're really talking about teenagers. We're not talking about primary schools. So there's no reason to look again at where we are in primary schools on the state of the current evidence. The second thing to be clear about is that evidence is, of course, going to lead to conversations between not just scientific and medical experts, but people with responsibility for the school environment to understand, are there more control measures we can put in place around the school environment? The third thing to make clear is that school staff are not a high-risk professional group, and actually the evidence isn't that there are higher rates of infection within schools for adults who work there. And when we do our contact tracing, we do understand that it's actually contact with other adults in the workplace or in the community that's the issue. And the fourth thing to make clear is we still don't understand all of the aspects around how that infection takes place. So we understand that within households, that's the biggest driver, but it's about, is that taking place with children mixing with other children in our secondary schools? Is it outside contact? Is it contact within their household? And is this part of what we're seeing in wider community transmission? So that's why the evidence today is important, but it's important to look at all of the things that are being said, including those really important caveats that school is not an unsafe environment for our children and young people. It is not an unsafe environment for our teaching and other school staff as well, but there's more for us to learn and understand, and that may lead to changes in policy provision that either myself, the Education Minister, or the First Minister would announce. Thank you, Adam. Now I've got young Dan Bevan from LBC.
Thank you, Health Minister. Good afternoon. South Wales Police revealed today that they broke up a house party at a student accommodation last Friday. 52 people, students, were all fined in that instance. I wonder what your message for those students involved is, and also your reaction to the story.
Well, for those students involved, they can have no complaints. The rules are very clear, and a gathering of that size within a house is plainly outside of the rules. And they need to look again at what they're doing and the risks they present to each other and to other people they will see, because, as I've just outlined, this is a highly infectious virus. It is a virus that last week took 143 lives in Wales at least, and we all have a part to play to keep the country safe. And I should say that the overwhelming majority of students are doing the right thing. When there are examples like this, part of my concern is an impression is given that every student is somehow behaving in an irresponsible manner. That isn't the case. Most students are being responsible, but for those that aren't, you can have no complaints if you do then face a penalty that the law sets out. And I hope that all those people who receive their penalty notices will think again about the choices they make in the future.
Thank you. And sticking with students, the Education Minister said on Wednesday that all students could be tested before they go home for Christmas. But Swansea University have since said that is unrealistic. And in response to that, Welsh Government have said that they are aiming to test as many people as want those tests. A simple question is which is it? Can everybody get a test, or is it as many as they want? And is the system reliant on there not being a 100% compliance on testing?
Well, I don't think things are necessarily inconsistent at all, Dan, because we're looking to make sure we have enough capacity to test every student, and we think we'll be able to do that. Working across the UK, we think we can do that. That's a significant undertaking. But testing isn't compulsory. And, so we're asking people to come forward to be tested, to give them, their friends, their family assurance. And this is a big, significant undertaking that we're looking to enact. So we'll do as much as we can. We'll make the offer. And it's then up to people, in follow-up to your first question, to be responsible and to think about what they could do, what they should do to make sure they're managing their risk and the risks that are present to other people that they'll have contact with. Because a great majority of students and young people want to be able to return to their families at the end of the academic year. This is a way to balance those risks, to give people that extra assurance so they can then go home, see friends, families, loved ones. And as I say, it's about what should you do to try to make sure that you're doing the right thing for your own family, friends and loved ones. And that is how each of us can play our part to help keep Wales safe. Thank you, Dan. I've got Andrew Forgrave from the Daily Post.
Good afternoon, Minister. Earlier you mentioned that the test protect system has worked well so far. That being the case, why the need to double capacity? And does this reflect fears that things could get very much worse over the coming weeks and months?
Well, we have taken the opportunity in the firebreak, as I said, to look at where we are on a range of fronts, including, and we signalled this in advance, the Test, Trace, Protect service. It's a highly effective service. It's trusted. The partnership between local government and the NHS has worked really well. I'm tremendously grateful to all those staff who are certainly doing their bit to help keep Wales safe. To make sure that they can continue providing an effective service that is part of how we keep Wales safe, we needed to look at the high numbers of cases and contacts that are coming through and whether we need to invest further. So we've already invested in that national surge team. We've already invested in a larger group of staff. We've recruited over the last few weeks an extra 600. The announcement I've made today to increase an extra 1,300 is because we do think we're going to face different challenges through the winter. It should mean that we'll have a more robust service. It'll give us extra capacity. We'll be able to see up to about 20,000 new cases and their contacts once we've got all these contact tracers in place. And crucially, that extra group of people coming in will not just mean we get to a continuing high number of people, but the speed at which we get to them as well, because the speed of contact tracing is a key factor for us as well. And I think it shows the government is being responsible. We're not waiting until our system is broken. And even today, you'll see that when you compare England and Wales, our contact tracing service has a 20-point extra success rate in terms of how many of our contacts we're getting to successfully. We want to maintain the high performance that we've seen. And again, that relies on the public doing their part too. So isolate when you've got symptoms, get a test, and please make sure you're giving as much information as possible, as quickly as possible, to contact tracers to allow them to do their part to help keep you, your family, your friends and your community safe.
Thank you very much indeed, Minister. What steps is the Wrexham government taking to ensure that Wales accesses its fair share of COVID vaccine? And could you just talk us through a little bit about how you would plan to distribute it around the country?
Well, we already have agreement in place about the vaccine being procured for the whole UK by the UK government. Each UK nation will then get its Barnet population share of that. So we already have an agreement and a guarantee about how much that vaccine will be provided, and the vaccine will be provided at the same time to each UK nation. Now, the challenge of then delivering that depends on the vaccine itself. You'll see the one that's currently being talked about with the storage requirements for, very, very cold freezer storage. So that means there'll be differences in getting that vaccine around and then delivering it. And we're already working with partners in every part of our NHS to understand how we would then need to deliver that. That also takes in colleagues in other parts of the public sector, because we may need to use different facilities to provide the vaccination to people. We've also, of course, got networks of vaccinators, for example, in community pharmacies to provide the flu vaccine. So it depends on the characteristics of each potential vaccine, and they are still potential vaccines. We don't have a vaccine yet that's passed all of its safety mechanisms. We then have expert advice from the Joint Committee on Vaccinations that will be provided to every UK minister, every UK government within the country. And I have then already committed that we'll take on board their advice about how to prioritise who to deliver the vaccine to in the first stages, and that will then be a guide about how we then need to deliver it. I'll be able to give more detail when we have a real vaccine candidate, but I hope people do take some assurance that planning is already taking place, and here in Wales, we would be able to deliver a vaccine if it is available before the end of this calendar year. Thank you, Andrew. I've now got Tom Magnus from Carers World.
Thank you very much indeed, Minister. Can I refer back to the answer you gave to Will from Wales Online about testing? In your reply, testing in care homes, this is, in your reply, you appeared to me to underplay the role of testing. I mean, when I speak to experts, they tell me it's critical to know where exactly you are in a given situation. So can you expand a bit further on why you don't believe it seems to be as critical as the scientists suggest to me?
Well, I've never suggested that testing isn't a key part of our response to the pandemic. It's key in terms of population testing. That's why I keep on saying if you've got symptoms, get a test. It's also key to dealing with potential outbreaks in care homes as well. That's why we have a significant regular testing programme for staff to understand if there is an outbreak in care homes. It's why what should happen because this is the position here in Wales. When we get a positive result, there should then be more significant testing, not run through the Lighthouse Lab programme, but through our NHS Wales labs to understand where coronavirus is within that care home environment. So it is a key part of our response, and I wouldn't want to try to suggest otherwise. But as well as testing, there are also other aspects to keeping people safe and well. And I think sometimes when we talk about testing, it's spoken of as if it's the only thing that keeps people safe, when actually there are many other things we need to do to help keep all of us safe. And that's why we're going back to asking people to think again about what they should do. And so it's our choices that will make the biggest difference in how we keep people safe. And that really matters for care homes, because if community transmission remains high, there'll be more risk to our care homes, and we're more likely to see corona get into more care homes across the country, and we all know the harm that that can cause.
You mentioned the Lighthouse Labs, and I think you said earlier that turnaround times were improving. There's another aspect in relation to Lighthouse Labs in our investigations on this subject so far, and that's the issue of false positives. There are examples where the initial positive from Lighthouse has been overturned by the Public Health Wales second test, thereby showing the false positives. And these seem to be running at a level that's well above that recommended for the care home situation by your government's technical advisory cell. What are you doing to try to reduce the incidence of false positives? But surely that must help the know better what the situation is.
Well, actually, this is a regular part of the conversation that my officials have with colleagues in the Department for Health and Social Care in the UK government. So we do regularly take up issues about the quality and the returns, the accuracy of tests from the Lighthouse Lab programme. But in many ways, we're better off having a false positive than a false negative. So if we then find out that actually someone isn't really positive, we can release them from their isolation and they can return to work and going about their business. The bigger challenge is if we get false negatives where people are told they don't have coronavirus if they do. So accuracy in either extent really matters. And it's why, going back to a previous point that a previous question raised about the accuracy of the test really does matter, because there are different forms of inconvenience and harm that are caused. If you're told you have coronavirus when you don't, contact tracers then looking to contact trace and track down your own contacts, isolating more people potentially unnecessarily. There's an economic impact on that as well, and potentially a well-being one too. If we have tests that give us more false negatives, then actually we're more likely to see coronavirus continue to spread in larger numbers. So it is why we place such importance on the accuracy of all of our tests in all of our labs and in the new tests that are becoming available. And that's why we're taking some time to understand how accurate those tests are before we use them in different environments, including the potential to use those new tests to enable a different approach to care home visiting. And I'm looking for an approach that balances and understands how we would prioritise new capacity, new testing devices to make sure we're given the assurance that people need to allow them to do things in a different way. But bearing in mind, of course, we still need to follow the golden rules on keep your distance, wear a mask if required as well. And this is really important for all of us, together with, of course, good hand hygiene. Thank you, Tom. Look forward to seeing your questions again. And finally, we had older Robbie at the start from Wrexham. We've now got younger Rob from Wrexham. It's Rob Taylor from Wrexham.com.
Good afternoon, Minister. Is it possible to have the latest updates on the Wrexham hospital outbreak? Is it ongoing? How many people are currently affected? And if that's not a figure you're comfortable giving out, can you give some context? For example, has the issue increased week on week?
I can't give those figures to date, but I'm happy to work with the Health Board to make sure you can have a public update that you can use to inform your readers and viewers across not just Wrexham, but the whole of North Wales. Because the challenges in each of our hospitals are different at different stages, and that's why it is a particular issue. And earlier I mentioned we're having some work done on care homes to understand infection emergency control there. There's also some more work we're doing on nosocomial transmission. That's transmission between healthcare staff and other healthcare staff and patients as well. So I'll make sure that that information is provided to you and other colleagues in North Wales.
Thank you. And going back to Will Hayward's point, you didn't reply on when the data on care homes will be released. When it is good enough to be relied on is quite a vague answer. Does that mean that the data you're relying on day-to-day in Welsh Government can't be relied on? And will this data be released by the end of this month?
I certainly hope it is. I'd like it to be released as soon as possible. I'm certainly not looking to hold up that information. The challenge is about management data that we use. It gives us an idea of trends and pictures. And when we publish information, our colleagues in statistics want to make sure it's as accurate as possible. That assurance process is important. So it's about moving from beyond management data into something we're publicly providing to public and other people that would allow them to make choices. So there's certainly no desire from the government to hold up information, to not make it available. It is simply about making sure we can do that, and I want that to be done as soon as possible. Thank you, Rob. Thank you, everyone, for your questions and comments today. I look forward to seeing you in the coming days and weeks ahead.